Department and all our guests this morning. I wish to welcome you to the Standing Committee on Health on this Wednesday, the 12th of May, 2021 at 9 o'clock. The committee will be briefed this morning by the Department of Health on the process followed by hospitals in the Western Cape in carrying out medical male circumcision. I do want to mention that members received this presentation this morning at 8:24. I'm sure we will receive motivation for that from the department, but it is quite difficult for members to do the necessary preparation. So I would kindly also request at this point to the department that they would kindly see to it that we receive the presentations for the Standing Committee in advance as per the normal procedure, please. Colleagues, I wish to remind you of the cardinal rules of our online engagements. I'm sure members are very much aware of it by now. I would at this point kindly ask that all members mute themselves, also turn off their videos. We do want to assure stable connectivity. Please draw my attention by raising your hand with a raise hand function. In the absence, kindly make use of the sidebar, the chat function, to raise any matter that you wish, should you not be able to raise your hands. Colleagues, we will ask the department to present, after which we will only then pose our questions, and then we also have some committee business we will attend to, and before that we will then obviously excuse the department. I would now kindly ask that all members present introduce themselves, after which the department and then our guests, if there are any on the platform as well. Kindly proceed, members.
Good morning, Chairperson Regan Allen.
Good morning, Chair Lorraine Botha.
Good morning, Chair Rachel van Vogel. Good morning, everyone. Member Baku Post.
Good morning, Chair Ayanda Barnes.
Good morning, Chair Melika Aklago.
Thank you very much, and that is all members. The Health Department.
Good morning, Chair and all members. My name is Juanita Arendse. I was appointed as a Chief Director, Emergency and Clinical Services Support in the Department of Health in January this year. Thank you for having me.
Thank you very much, Ms. Arendse, and a warm welcome to you as well. Any other members of the department?
Excuse me, Chair, I'm aware that Dr. Karim, I think, was supposed to join us this morning. I don't see him on the call. I have tried to contact him as well, but I haven't had a response. Apologies. I will continue to try on the side.
Thank you so much, Ms. Arendse. Any guests? None. Thank you so much. Any apologies? Ms. Jamke, any apologies from your side?
No apologies, Chair.
Thank you so much. And we do have a quorum, so we may proceed with this committee meeting this morning. I will now ask the Health Department to kindly proceed with the presentation, after which members will have the opportunity to pose their questions. Will you kindly proceed? Thank you.
Thanks, Honourable Chair. I'm just checking, Ms. Yankee, can you see my slides? I'll get into slide mode, Ms. Yankee.
We cannot see it yet.
You can't see it yet? Okay, let me just redo it. Some apologies, Chair. Sometimes the technology lets us down. I'll close it and do it again. I'm gonna do it in slide mode in a minute.
Sure.
Once it reflects.
And a warm welcome to you as well, Mr. Karim, and thank you for joining us.
Thank you, Chair. I was about to just give apologies for the HOD, but to do it formally, but I just want to make sure my slide's up.
Yes, we can see them.
Okay, right now I can officially start. So apologies. Thank you, Honorable Chair and Honorable Members. Apologies from Dr. Kluti. As you know, Dr. Kluti is in cabinet this morning, and so he's asked me just to stand in. We were asked to present on the voluntary medical male circumcision services in the province, and so that's what I'll be doing in the next couple of slides. And as members would know, I mean, we actually started MMC as an HIV prevention intervention, and it's been, you know, it's been scientifically proven that it does reduce the chances of acquiring HIV infection. In fact, as much as 60% chance of reducing HIV infection. So it's actually quite an important pillar of the HIV prevention campaign, and we've been doing this for quite a few years in our services already. There are additional benefits to this in the sense of obviously reducing chances of HPV. HPV is the human papilloma virus infection, commonly also amongst men and women, but because of medical male circumcision, it obviously has an additional benefit of reducing human papilloma virus infection amongst women as well. Um, and what we did as part of a men's package of healthcare, and I'll come to it in a minute, it's part of that package of men's healthcare, and we've been promoting this for some time, and we've actually had an additional focus over the last year on MMC, and I'll come to that in a minute. At the moment, it's offered in a variety of settings, and we try and do it as far and wide as possible so that we get a nice geographic spread across the province. There's a combination of fixed facilities, mobiles, and then obviously dedicated MMC settings. And that brings me to the next slide, which is effectively the launch of the Metro Men's Health Center on World AIDS Day last year. It's a service that we launched. It's based physically on the premises of Karl Bremer Hospital, but it's really an excellent. We took part of an unused part of the hospital, which is actually an old storeroom, and we converted that into a Metro Men's Health Center. So it's not, while it's based at Karl Bremer, it's for the entire metropole. And all our services can actually refer men to the to the men's health center. Obviously, a large portion of what's done there is medical male circumcision, but it is in fact a comprehensive men's health center. So you can even go there and have screening blood tests for your prostate, for a whole range of conditions that affect men particularly. It's a really good center. It's run by a team of experts who have been working in the area of men's health for many years. And we've also been doing medical male circumcisions for many years. So it's a really wonderful center. It's not a physically very big center, but it's really adequate for the purposes required. And if there are conditions or that the center feels that they can't deal with, that requires more specialized intervention, then obviously from there, men can access the health service platform all the way up to tertiary care if required. In a sense, bookings are done by telephone, SMS, or WhatsApp, so we try to make it as easy as possible for people to access the service. And it's really a very extremely cost-effective service in terms of staff utilization for elective procedures. So, I mean, because we got it all concentrated in one place, we are obviously able to roster the staff appropriately. Obviously, with COVID-19, we have to screen clients for that, but it's really offered as a service, as a walk-in service as well. We're obviously depending on the bookings and the number of patients that we have for the day, but we really do in fact try to offer a walk-in service as well for men. So in the sense of the client journey, yes, as you come into the center, there's a preparation room where we also do wellness screening. So we can do all of the blood tests, all of the tests that you see there. We measure your weight, measure your height as well, in fact. And as you know, that gives us an index called the BMI, the body mass index. And body mass index is often a marker for other illnesses as well. We can test the urine, obviously, and we test for a whole range of conditions in the urine. We do general screening for your blood pressure, for your sugar, which is HGT. With blood pressure, we'll check your sugar. And we'll obviously test and see if there's STI symptoms present. And if necessary, we'll do a blood test as well, if there's any STI, sexually transmitted infection. And obviously for those men older than 40, it's important to have prostate screening done. Prostate screening is a clinical examination, and if necessary, then there's also blood test that gets done. So it's really quite a comprehensive service. It's not just medical male circumcisions, but we try to offer an entirely a full package of care. Like I said, that medical male circumcision is an important part of that. Then from there, there's a procedure room where there's a doctor, medical officer will assess the patient, assess the client, get the consent, conduct a physical examination, and see if there are any contraindications to conducting a circumcision. And then they can actually go ahead and actually do the circumcision. Or sometimes, and we often do find that clients haven't perhaps thought it through carefully enough yet, or they're not ready yet, perhaps. And so if they want to, we can defer that and we'll give them a booking for another date, because we really would want people to come back. And try to make it as client friendly, patient friendly as possible. Obviously, once the circumcision, for those who do decide to go through with the circumcision, once it's done, the client would then go to the recovery room for half an hour. Or depends if it's sometimes longer recovery required, where the doctor will make a decision in terms of how long the person needs to be recovered. There's a competent whole squadron, if I can say that, of nursing staff that will observe the patient, do the post-op counseling, provide follow-up dates, and if necessary, provide pain medication. And because we understand that people are also at work, it's important that we also provide a sick certificate. Follow-up, in terms of follow-up, the clients can return after 48 hours, and they certainly must return on day 7, so that we can just have a look at the condition of the patient and just make an assessment. If necessary, the follow-up can also be done at a primary healthcare facility, if that's more convenient and perhaps closer to the client's home, in which case they will obviously get a little note to say, dear colleague, etc., we've conducted a circumcision, and just for whatever issues need to be followed up. And the doctor will then follow up any post-operative issues either at the clinic or at the primary healthcare facility. So, Honourable Chair, I mean, that was a short run through of the service, of what that we offer. I think the fact that we are able to talk about this on a platform such as this, an important platform such as this, is already for us really a big step, actually, and that, in fact, a big win. And I just wanted to use the opportunity to showcase that Metro Men's Health Centre, and through your offices, we can invite you at some point just to do a brief visit, obviously with COVID protocols being observed. But it's really encouraging to see the standing committee take an interest in this part of the service, which is, doesn't always have its opportunity to shine. Thank you,
Yes.
Honourable Chair.
Indeed, thank you so much for the presentation. We welcome the presentation this morning. Members, you now have the opportunity to pose your questions by a show of hands, please. I recognize Member Barnes. That is the only hand that I can see at this moment, as well as Member Botha, in that order, and then Member Windvogel. Member Botha, are you covered?
No, Chair, I'd like to still ask my question, but I just lowered my hand because you acknowledged
I
me.
saw your hand going, afford you the opportunity after. So it's Member Barnes, Member Botha, and then Member Windvogel. Kindly proceed, Member Barnes.
Thank you, Chairperson, for the opportunity. I take very much interest into this topic. However, Chair, I first would like to get an indication whether the presentation is only about the Metro Men's Healthcare Center, or is it general about the circumcision of male, or should I continue with my questions, because my questions will be based on the answer that I get from this question.
You can pose your question,
Okay,
Member.
Chair, on the second slide, I've noted that it is stated that NPOs are partners of I'm sure the department, I think. What I want to know is that what is the role that the NPOs are playing within this sector, and how are they monitored by the department? My second question is on the preparation room. Who is taking responsibility of the preparation room? My reason for asking this question is, Chair, I came across in the Karoo in a scenario where I've seen the procedure room. And I was not quite happy because I got pictures of photos taken in a procedure room by community members. Now you want to know how does it happen and who is actually responsible for the procedure room. Hence, my first question also on the NPO, how these NPOs are partnering with the department. And then the last question, Chair, is on the procedure room also. Who is responsible for the actual surgery? I think I'll park for now there. I'll have follow-up questions once I'm clarified on the ones that I've asked now previously. Thank you very much, Chair.
Thank you very much, Member Barnes. You will be afforded the opportunity. Member Botha.
Thank you very much, Chair. I'd like to ask the department, what is the kind of feedback, if there is any feedback from patients that has gone through the procedure? And in regard to the procedures done, are there any, I don't want to say comeback, but any severe impact on the procedure in regard to patients? And then also I'd like to speak the department to speak, and I'm latching on to Member Barnes. Excuse me, Chair. What happens in the rural field in regard to male circumcision? Thanks.
Thank you very much, Member Botha. Member Windvogel.
Thank you, Chairperson. Chairperson, I'm partly covered by Member Barnes, but what I want to know from the department, this services, is it only done in hospitals or at hospitals? The reason why I'm asking, I'm thinking of places like Berrydale, where there's no hospitals. How are they dealing with that, especially in the rural, far rural areas? Thank you, Chair.
Thank you very much, Member Windvogel. Can I please ask that at this stage the department please remove the presentation? I've also recognized Member Marais.
Good morning, Chair. I'm sorry I'm late, but the department failed to send me any lock-in particulars. I couldn't lock in. I will query that later with them why they ignored me. But I'm here now, and I would like to know what brought this about. How many people are there really that demand circumcision, or is it a cultural issue that only affects certain cultures? And are we now going to budget expenses for any particular culture at the exclusion of others? Or what is the reason behind this? That we are now going to do circumcisions, whereas it is not acknowledged that this is of general application, where the Constitution says any law passed must be of general application. Now, can I just get an explanation from the department?
Thank you very much, Member Marais. From my side, I am basically covered. I think there's quite a few members that made mention. The department made mention of the Metro Men's Health Center. My question would also be in terms of your outer areas, your rural areas. Is there in the planning going forward any such center envisaged? And if they say it's specialized services, how does the referrals work from our rural healthcare facilities to this specific center where those expertise exist at this point in time? So I will also conclude with that and afford the department the opportunity. Thank you.
Thanks, Honourable Chair. So I'm going to start with Honourable Member Barnes' question. I think it was around the NPOs and the role that the NPOs play. So in terms of trying to expand the medical male circumcision in the province, we engaged through funding that we received from USAID with some partners. And what the partners do for us, in fact, they they actually themselves conduct the circumcision. It doesn't require like an operating theatre or a very complex physical infrastructure space. It just requires obviously a sterile procedure room to be able to conduct the circumcision. So the NPO partners, and just to partially answer Member Botha's question as well, the NPOs, there are also NPOs that cover the rural areas, but the idea and the intention was to in fact expand the service beyond just what the health platform ourselves could do through funding, as I said, from USAID. So it was really just to try and get a bigger footprint of VMMC services in the province, metro and rural. In terms of who does this, the procedure, that must be it's a medical doctor who has to do it. And obviously it requires a bit of training in the sense of medical doctors needing to understand how the procedure is conducted and how it's done. So it's got to be a medical person that has to do it, but obviously there's a team of people, including nursing staff, who have to do, as I said, all the other issues as well, the weighing and the checking of urine, etc. So there's a team of people that actually does that. In terms of Member Botha's questions, the feedback from patients, generally the feedback has been positive in terms of how they experience the service, and we're obviously very interested in also monitoring people. And I think the question from Member Botha was around side effects or severe, I suppose, any severe effects from it. Generally, there are none, because I mean, one obviously just cuts the foreskin, and we just must make sure that it remains sterile and that it doesn't become infected. So that's really the critical one that we look for. And that's why we insist that people have to come back after 48 hours, and also then absolutely after 7 days. It's an absolute must that they must come back, so that we can actually just check whether everything is still good and whether there's any further treatment that's required. In terms of Member Windvogel's question, I think it was around hospitals. No, this, like I said, this can also be done in any sterile procedure type of room. It doesn't require a very complex physical space, which is why we extended the contract through the NPOs to help partner with us in terms of expanding and extending the services right across the province. In terms of Member Mare's question, from a demand perspective, and I remember Mare was asking about the cultural aspect of it. Obviously, from a medical perspective, our rationale and reason was primarily around HIV prevention. But having said that, there's obviously a mix with cultural issues as well. So there are many men who actually come to the service because it's a cultural issue. For them, it's a cultural circumcision that has to be conducted. We're happy to provide the service because we know that there's, as I said, a 60% reduction in chance of HIV infection. So from both a health perspective as well as from a cultural perspective, it's really an important and critical service that we offer. In terms of, Honourable Chair, of your question, in terms of the rural areas and how referrals work, so we use through our partner NPOs who are helping us in the rural areas, but we also do it at some of our clinics in the rural areas. And in terms of the kind of expertise, given the volume that we have and experience in the metropole, we thought it's easier just to more centralize that in the metropole, and it is easier because it's geographically smaller. It's a bit more difficult to do that in the rural areas, so we obviously need different centers of excellence, as it were. But our medical staff at the big hospitals in the rural area are the points of referral and contact points. Then, should there be a requirement for anybody requires any questions that they need to be answered, or any expert advice, and they can obviously contact the Metro Men's Health Center as well for any expert advice. So generally, we try to spread the expertise across the province in that manner. Chair, I hope I covered all. I think I've covered all.
Yes,
Chair, my hand is up. I'd like to ask a follow-up, please.
Yes, Mr. Mare, just one moment. Member Mare, I think your questions has been covered. I've had an indication from Member Barnes that she wishes to pose a follow-up. Then Member Mare and then Member Windvogel in that order. Thank you.
Once again, thank you, Chairperson. Maybe because I'm also hailing from the rural areas, I have a special interest in this topic. One, I want to be clarified, Chairperson, on the last part from the presentation where it is said that clinics are used in the rural areas to assist with these procedures. One, what I want to know is that does the clinic staff now automatically become the surgeons, or do they form part? How is it working in the rural areas? And my reason for asking this, Chairperson, is because I have witnessed a procedure in the rural areas with a 10-year-old boy happening for 1 hour, which was something very abnormal. Now, the reason I'm asking again is because I want to know from the first question that I've asked, who is taking responsibility? I understand that it is said to be not a very complex surgery, anyone can do it. But in the case of that boy, if something goes wrong to that boy, who is taking responsibility? Is it the NPO or is it the department itself? I just wanted to be clarified on those two matters, Chair. I am good for now. Thank you. You are muted, Chair.
My apologies. Thank you, Member Barnes. Member Marais, you may proceed.
Chair, I'm not quite satisfied with the answer I received, although you said it's covered. Cannot be covered, because if the department says that circumcision prevents HIV infection, I haven't seen them advertising and encouraging people or even making it a law or making a regulation. All males must be circumcised, because that's our way of preventing people from getting HIV. This will be a portion of the population who's going to go and qualify for it. Now, how do you fight HIV if you only circumcise a certain section of the population? I don't think this is an adequate answer. Some cultures also believe in cutting their faces and marking their face. That can cause infection. Is the next bill before this house going to be that people will be cut at clinics or at hospitals to mark their faces in a certain way? I'm not sure where they are going to with all this. If the Khoi people come tomorrow with their demands for cultural habits, which we must finance, are we going to also accede to their request? We are opening a Pandora's box here if we are going to budget to finance the habits and rituals of certain cultures only.
Thank you, Member Marais. Member Windvogel.
Thank you, Chairperson. Chair, my question to the department is there perhaps a detailed breakdown of numbers of VMMC that has taken place in the past 2 years? And also, what type of programs are there to encourage males to undergo the MMC? Is there any programs, awareness about this services? Because I think it's very important in the light of, prevention, HIV prevention. Thank you, Chairperson.
Thank you very much, Member Windvogel. Member Tego.
Yeah, thanks, Chair. I'm partly covered by what Member Van Vogel just asked, because as a person who previously worked in the prison department in the rural areas of Canaland, this process has unfolded before, and there was a proper awareness that was done, but it was within the prison service, not necessarily a community-based kind of campaign and awareness. And it resulted in a very positive light. We would take from time to time batches of offenders to go and undergo the process. But now the challenge that we would be having is that how well do we make our people aware of this? If you would check the kind of questions that come from Honorable Marais, it's on the basis of the lack of awareness, because this process is not a cultural matter. This is a health issue, a a scientific issue that needs to be addressed. It has been scientifically proven that there are serious challenges that are facing males, such as prostate and everything else. And this can curb such kind. It's a health matter. It's not a like this one is Xhosa, this one is Nguni, this one is Khoi. It's something that is affecting our people. But now, if you check the level of awareness, if from a person who's a lawmaker is lacking in that kind of regard, then how about an ordinary person in the rural areas? How about our people in communities? If we can get the marketing strategy and the publication of this so that our people would know where to get. And then coming to issues of rural areas, like I said, if in Ladysmith it was conducted in a district hospital, so which means therefore this thing can be, if it's coordinated well by the department, it can be done anywhere. But like Member Pants was asking that if we are working in collaboration with NPOs and NGOs, who would be responsible in a situation whereby we're facing health challenges such as botch processes and all that. Thanks very much, Chair.
Thank you very much for your input, Member Kego. Mr. Karim.
No, thank you, Chair, Honourable Chair. So I'm going to start, and I realize Ms. Arendse is also on the call. I didn't see her name; they pop up. Ms. Arendse is our Chief Director, and this program and all of its related aspects fall directly under her patch, so she can also help me answer some of the questions. Welcome to Juanita. So to start with the responsibility, because obviously it's like we do with all our other NPO contracts, and we have many NPO contracts. If it's an outsourced service, then obviously they would take responsibility. That's the first question that Member Barnes was asking about. But like we said, it's not, because it's not a very complex procedure. We obviously they have to take responsibility, but they must also make sure that they have adequate staffing in place to be able to conduct the procedure, and obviously to be able to make sure that people get monitored after the procedure in terms of follow-up visits. So that's in terms of responsibility service, and we have NPO contacts with many other services as well, because they really help us in terms of accessing the furthest parts of the province and to able to get the service out there. I'm going to ask Ms. Arendse if she wants to talk a bit about member questions that Member Marie raised in follow-up in terms of regulatory aspects of it. Obviously, it's voluntary, and that's the whole key aspect of it. It is a voluntary service. But Juanita, do you wish to tackle any of those?
Yes, thank you. Please, Ms. Arendse, and perhaps also speak to the awareness issue. Thank you.
Thank you, Chair. Member Marie, just to maybe take us back about 8 years when VMMC really got going on an international platform. I go back to an international AIDS conference at around 2014 also, with a very strong stream within prevention, with a very clear focus on VMMC at an international level. So I think maybe just to clarify for Mr. Marie is, if we look at prevention in general, we see it on an international scale as various slices within a round pie. So every slice of prevention addresses a certain population group. So for example, prevention of mother-to-child transmission is applicable to pregnant women and the young babies. Condoms, for example, male condoms, female condoms, HIV counseling and testing, and then VMMC. So it's almost like if you put all these prevention activities together into a bouquet on an international level, the recommendation is that it should be driven, all those aspects should be driven to its maximum extent, so that you sort of hit prevention from all angles. So when we sort of joined in on the evidence that was available, we did it from a perspective of what was evidence-based, what was not just international practice, but obviously many other African countries as well, and other developing countries such as ourselves. So it was not, the decision was never based on cultural preference or cultural practice at all. What we do find is that, and maybe I'm touching on to the next point without intention, is the statistical data also shows that the clients come from all areas and geographical spaces and so on. So there was no decision made that aligns to a cultural preference. It was really based on evidence and on offering more of the bouquet of prevention interventions for HIV, as you know, to sort of close that loop. And then moving on to the marketing and so on, there's been lots and lots of marketing and a major thrust towards encouraging the greater many in the population to come for medical male circumcision. There was I think we made lots of headway. There was lots of media campaigns also run by other NGOs that were partnering with us called Man Up. You might have seen the Man Up posters were practically everywhere, green and white posters, and there was various other sort of campaigns and radio campaigns that went really, really viral and caused lots of humor in that space, but really encouraging men to come forward and to have a circumcision. So I think what Member Windvogel experienced maybe in the prison sector was happening in the communities as well. What we did find, especially in the metro, and this was what led to the Metro Men's Health Center, was that a lot of the teams are roving teams. If somebody who had an appointment for today was unable to arrive today due to whatever personal circumstance, then that person would have to wait for the roving team to get back there in the next, say, month maybe. And then that's often how we lost some of the men along the way. And that was the reason for also aiming to set up a fixed site where we could book appointments predominantly, but also take walk-ins. So the marketing has been ongoing. Obviously, in the last year and a half or so since the time of the pandemic, there has been sort of a major slowdown on major marketing like it was before, only because of COVID regulations and how we had to comply with that. And even when we set up the Metro Men's Health Center, it was done in such a way that we could keep lots of feet away from the primary healthcare facilities and channel it this way, because the primary healthcare facilities at that time were dealing with obviously COVID testing and care for clients. And then also to ensure that we do it in this way in a very, very sort of COVID compliant or regulation compliant manner. Thank you, Chair. I trust that I've covered the question. Thank you.
You have indeed. Thank you so much, Ms. Arendse. Members, are there any follow-up questions? Member Barnes?
It's my last one, Chair. Chair, actually, I've asked this question earlier when I asked how the department is monitoring. I'm sure there are ways of doing compliance within the NPO sector. They must be compliant before they get the opportunity to do such work. What I want to know is that how the department is keeping them accountable in terms of looking after the compliance, or how are they reporting so that you know that the actual work is getting done 100% the same way it's done in the metro, the same way it's happening in the outside rural areas, because I'm sure here in the metro there's a better view at the men's healthcare center to look at things. While you are outside, there's no way of saying that it will be done perfectly because it's far. Now, what I want to know, how the department is monitoring this entire process, what measures are put in place. Thank you, Chair.
Thank you very much, Member. Ms. Arendse, will that be you?
Sure, yes.
Okay, Juanita, you want to go? But I mean, just to say in general, Chair, Honourable Chair, we do have a contract in place with these NPOs. So, you know, it's not just a sort of an agreement, a verbal agreement with the NPOs. We actually have a hard contract with them that we can hold them to account. And we generally have that kind of strategy for all our NPOs where we contract with. And obviously the monitoring is part of that. But Ms. Arendse, I want to just add to that.
Sure. Thank you, Chair, and thank you, Dr. Karim. So maybe just to add to that is that the contract also stipulates the qualifications of each sort of member in that team that conducts the MMC, and in particular, obviously, the circumciser themselves, the training that needs to have been gone through. And then there is a local link. If I can make an example of Grabouw, we were called out a good few years ago to Grabouw because they wanted to, there were some challenges with the NPO that was providing the MMC at that point in Grabouw. So just to reiterate that even though the NPO was conducting the medical male circumcisions, it was happening at the Grabouw facility. And so the oversight function of the manager at Grabouw was why we could quickly pick up that something needed in immediate intervention. And then we went in and assisted with that process. It wasn't a training issue. It wasn't sort of an issue aligned to capacity or capabilities. We then uncovered that there was a challenge with one of the materials used, just as an example of how the oversight happens at the local level. So, and then in terms of how we then monitor adverse events or what they call botched sort of MMCs, there is also a very tight recording process with regards to that. There have been incidences, obviously, of adverse events, just like it follows could possibly follow any surgical procedure, and lots of additional training. And I'm talking about what has happened over this probably 8 to 9 year period has been an ongoing process. And I must say that there has been less and less such events reported. Whether that was conducted in our services or in the NPO sector, there is always a risk of that taking place. We haven't noticed that there was anything increased in the NPO sector or even in the private sector that is also contracted in the rural entities, that we haven't noticed an obvious difference. But it's something we keep our finger on the pulse with, and there definitely is a governance and oversight role that is provided at a higher level contractually, but at a local level to also make sure that procedurally and clinically things are happening according to what it should be. Thank you.
Thank you, Ms. Arendse. That is indeed very reassuring to hear. Member Windvogel, I see your hand.
Yes, Chairperson, I'm not sure my question in terms of detailed breakdown for the past 2 years was answered, if it was answered. I didn't get that far.
Thank you, Member Windvogel. Should the department be at liberty to share that information with us, you are welcome to do so. If not, we will then make that part of our resolutions and recommendations going forward in this meeting. Dr. Karim,
Yes,
do you have the information?
Absolutely, Honourable Chair, we will provide you with that information. So we understand the request specifically is information on VMMC right across the province for the past 2 years. I mean, the committee would want to see that detailed breakdown.
Yes, that is what I understand from Member Windvogel. Can you confirm, Member?
Yes, Chairperson.
Okay.
Thank you.
We will also formally put down as our resolution.
Yes.
Thank you very much. Are there any further questions, members? I don't see any new hands for either a new round or follow-up. At this point, I will express my sincere thanks and appreciation to Dr. Karim as well as to Ms. Arendse for affording the opportunity to the Standing Committee on Health this morning to get a better insight into medical male circumcision in the Western Cape. And as alluded to, we will relay further recommendations or resolutions to the department. So thank you so much for your time this morning, and we wish you all the best in your work. Have a blessed day and please be safe.
Thank you, Honourable Chair. And it's really, like I said, we really appreciate that this committee actually has taken an interest in this topic because, like I said, it's one of those topics that doesn't often come up on the agenda. Member Marie might have forgotten, when we launched the Provincial AIDS Council, 20 years ago, when he was still MEC for health. I was, in fact, the Deputy Director for the HIV program at the time. We've come a very long way, Honourable Chair, that we can have this conversation on this platform. So thank you very much for that opportunity as well.
Wonderful. Thank you so much.
You did wonderful work. I remember you.
Thank you, Mr. Mario. We're very happy to have you here this morning. Thank you, Ms. Arendse. Dr. Karim, you are excused.
Thank you.
Thank you. Colleagues, we will now proceed to recommendations and resolution relating to the presentation that we've just received. We have noted yours, Member Windvogel. We have captured that, Ms. Jamke.
Chair.
I didn't write anything.
Colleagues, can we please have order? Ms. Jamke, have you captured Member Windvogel's request for information?
Yes, Chair, I have captured two recommendations. The first one is a detailed breakdown on the MMC conducted in the province in the past 2 years. And the second one is the awareness, what kind of awareness is in place to motivate people to participate in this kind of service. I think it's more about the marketing strategy, how the department market this kind of service to the community at large.
Thank you very much. Thank you. Is there something you would like to add to that, Member Van Vogel?
Yes, Chairperson. Perhaps, yeah, thank you, Chair. If they can also include a breakdown in the regions, not only in the whole province, but also go down to regions, regional wise. Then the last one, if I can also add perhaps a list of NPOs that they are partnering with. Thank you, Chairperson.
Thank you, Member Van Vogel. So regional district wise, you mean. Member Mare?
I would just like to say, Chair, that we should also have a resolution asking that the department make renewed efforts at marketing the medical benefits of circumcision so that it could reach a broader section of the population and that it doesn't become something which is only adhered to because of cultural considerations, but it become a national program.
Thank you, Member Mare. Ms. Jamke, will that be a recommendation as such?
Yes, Chair.
Thank you very much. And obviously, we can only speak to the province.
Yes, Chair.
Thank you very much. Any other member? Thank you, Member Mare. Nothing? Can you just capture that for us again, Ms. Jamke, just to make sure? Ms. Jamke, you might be on mute.
Okay, Chair. The resolution detailed breakdown on the MMC conducted in the province in the past 2 years. This breakdown must be, the details must be in a region, district, like the information that when the department submits it. Then the marketing strategy of this service. Then the list of NPOs the department is partnering with on this MMC service. The department must market the medical benefit of the MMC to get attention from the public at large, something like that.
Members, happiness? All in order?
I concur, Chair.
Thank you very
Yes,
much.
Yes, Chair.
Yes, Chair, that's fine.
Thank you so much, everyone. Members, then we conclude with point 9 on the agenda. Other matters for discussion. Members, we need to discuss the way forward for the establishment of a TB caucus in the Western Cape Provincial Parliament. The background relating to this matter, the South African TB Caucus Secretariat contacted our committee in February this year, requesting to engage with the committee and discuss the establishment of the Western Cape Provincial TB Caucus within the Western Cape Provincial Legislature Standing Committee on Health. The South African TB Caucus Secretariat pointed out that the TB Caucus is a global initiative aimed at having members of parliament involved in initiatives aimed at eliminating TB across South Africa. And because the Western Cape is an integral partner in the fight against TB, the South African TB Caucus Secretariat requested then to brief the committee on this matter. And indeed, the committee was briefed by this organization on the 3rd of March this year. Members also actively engaged with the officials from the SATB Caucus Secretariat and the departmental officials on this matter that are serving on the Provincial AIDS Council Secretariat. Unfortunately, members, in this meeting, the committee did not make a decision on the request of an establishment of the TB caucus within the Western Cape Provincial Parliament. So now the committee needs to decide whether it supports the request to have the caucus established in the Western Cape Provincial Parliament, The chairperson, or rather I would request members to kindly provide their input and to engage on the matter on a way forward. If the members do accept that we need to establish such a caucus, we will then have to write to the Speaker of Parliament and engage him on this request. I would like to have your input on this matter, members. By a show of hands, please. Any member? Member Van Vogel?
Thank you, Chair. From our side, we will support the initiative of this TB caucus. It's just perhaps I'm not sure the function or what we are supposed to do, if they can outline our responsibilities. But I will support the initiative, Chair. Thank you.
Thank you very much, Member Van Vogel. I think that specifics were provided during that engagement with the committee, but I will ask Ms. Jamke to just again relay that information. Members, can we then agree as a committee that we are in concurrence of establishing a TB caucus within the Western Cape Provincial Parliament, and then as an action step, we will now write to the Speaker of Parliament engaging in this process. Is that fine with all members?
Yes, that's fine.
I got a raised hand, Chair.
Please proceed, Member Mare.
Yes, I would support it for the very reason that most of the deaths from HIV, you don't die of HIV, you die of mostly of TB, tuberculosis. But although they say the HIV is the real cause behind it, most of the people, I ran an HIV clinic in Elsa's River for 6 years. And so it is very important that we give attention to tuberculosis. And I think it's high time, and it's a very good suggestion that we get directly involved as a legislature in combating tuberculosis, which really affects mostly the impoverished, the poor people living in crowded conditions. We have shacks and shanty towns all over, very unhealthy situations. And I'm surprised that we never thought of it before. We're going to get directly involved in the needs of the poor and the impoverished people who live in such conditions, especially with winter coming. So I laud the proposal, and I would say we must go into this committee with a lot of guts and energy to try and break the backbone of tuberculosis, which is endemic in the Western Cape mostly.
Thank you very much for your valuable input, Member Marie, indeed. And we have seen the commitment from our Premier as well as our Western Cape Health Department. So yes, obviously, definitely so. We can now conclude that point as the committee resolved that we will now write to the Speaker to begin that process and engaging on the process. Members, Ms. Jamke, we have also a point where we would want to speak to the appointment of WCPP members to hospital boards. Will you kindly indulge us?
Yes, Chairperson. As we know that the committee has engaged on this matter in our previous meeting, and the issue of the appointment of the members of Parliament in terms of Section 2, in terms of Section 5(2)(a) of the Western Cape Health Facility Board and Committee Act of 2016 was discussed thoroughly. We got legal advice from both the department and the Western Cape Provincial Parliament legal advice. And the minister has responded to the committee, and the response from the minister was that the committee the members of parliament there's no need for the members of parliament who wants to be appointed in these boards to fill any forms. The process for the appointment of the members of parliament to the hospital board is for the committee, for the Standing Committee on Health, to compile the list of the members who wishes to serve in this board. Then that list will have to be minuted. We have to it has to be reflected in the minutes of our meeting. Then we send the list to the minister for approval and appointment. And the minister has shared a list of hospitals where there are vacancies. I think all members of this committee received that letter. What we need now is the members to indicate whether they want to serve, and if so, in which hospital, in which boards. And so far, Chairperson, I have received a request for nomination from member Vinvochel. She has indicated, she submitted her name. So the other members can also indicate if they want to be nominated to the boards, and if so, which hospital boards do they want to be nominated to. Then we can compile the list and submit it to the minister for appointment.
Yes.
Thank you, Chair.
Thank you very much, Ms. Jamke. I think we will afford the opportunity for members to just peruse those lists of vacancies on the boards once again, and we provide a deadline to members to provide their names to you. Can we make that coming Friday at 12? Friday is the 14th of May at 12 o'clock. Will members kindly see to it providing your hospital of preference? Ms. Jamke, a question from my side. It makes mention of WCPP members and not just as members of this committee. How is the other members dealt with? Are they writing directly to the minister, or should they also submit to this committee?
All members of parliament, Chairperson, who wish to be part of the hospital board, that request needed to via the committee for approval. Members of parliament cannot write to the minister directly. That will be unconstitutional in terms of the appointment process for the members. The committee needs to note that, and it needs to be documented in the minutes of the committee. Then we forward the names to the minister.
I see. In all fairness, Ms. Jamke, for members not saying that they did not know, but also in terms of monitoring and sound and administrative process, do we now as a committee write to members, or do the speaker write to members? At some point, we obviously want this to serve before the next committee meeting. So we would also want that information to be forthcoming at a certain point in order for us to approve at the next committee meeting and then submit to the minister. So how would we deal with that?
I think, Chair, I must just maybe flag the letter that we received on this matter from the minister so that members can also engage on that. Let me just present that letter. It's somewhere in my documents.
Okay. Thank you, Ms. Jamke. Member Mare, I saw your hand.
Yes, thank you, Chair. This is a very interesting topic, and I'm happy it's on the agenda. But any move has consequences. Members might be asked to attend meetings which clash with parliamentary meetings, so we will have to see which takes precedence if he serves on there. Secondly, will the member incur any expenses or costs, traveling, etc.? Out of what budget is this going to be financed? If a member of the legislature serves on this TB committee and he needs to travel or attend a meeting or anything like that, can he claim it from a constituency allowance, or from which allowance is the member going to be allowed to claim this? So let us first put this back into the committee for a full discussion and a presentation by Parliament, what it will entail, what additional responsibilities will there be for members of the legislature serving on a TB committee before we commit ourselves? And also, I would like to know whether this is something which the health committee decides on, or is this something that the Premier and his cabinet decides on which members must serve? Because this committee is not part of the committees of the legislature. It's something new. So let us be careful and first consult the Premier whether he has the prerogative to say who serves on it, like he has the prerogative to decide who is his cabinet.
Thank you very much, Member Marais. You have actually taken us back to the point that we have concluded, and that is exactly what we're going to do by writing to the Speaker in terms of outlining exactly who, when, and where, and the roles and responsibilities pertaining to that specific caucus, as it has not been done before. We are now at the point of appointing members of the Western Cape Provincial Parliament to hospital boards. So the question was raised in terms of how will we deal with other members, since the committee has to make, or rather approve that members and then submit to the Minister for approval and appointment for members of WCPP to the various hospital boards. Member Barnes, I see you, and then Member Botha.
Thank you, Chair. A quick one. I note on the list that my constituency is not reflecting. I also understand maybe because it's not you. However, what I want to know is that there is no MPL on the board there. Can I be co-opted? I'm asking it deliberately at this meeting. Thank you, Chair.
Thank you very much, Ms. Barnes. What we will do is we will share that information again with all members. And then as you indicate your availability, you will just make mention next to that it's not due, or rather in a motivation, and then we will deal with that accordingly or see what the outcome of the minister is. Member Botha.
Thank you very much, Chair. I'd just like to ask through you to the procedural officer, has the notification also been sent from this committee, like she has sent it to all this committee members, to other members of Parliament, or has it just stopped with us in regard to being, applying to be a board member? I just first want to know that through you, Chair.
Thank you very much, Member Botha. Ms. Jamke.
So far, Chairperson, it was only the members of the committee. Since this matter in our last meeting, the members said that it will be discussed. We need to put it on hold. It will be discussed in our next meeting, which is that next meeting is this one. But I've received a request from few members from, I think it was Member Bosman who requested the list, which is I've shared with those that requested. But so far, it has been only shared with the members of this committee. Then the members can advise if I must just share it with the rest of the members of Parliament. Thank you, Chair.
Thank you, Ms. Jamke. I also know, Member Botha, that Mr. Seen Stacey from the department, he has indicated to me that he has shared that information vastly to all members. But again, we need now to streamline the process, since it's not just Standing Committee on Health members, it relates to all members of the WCPP. So yes, I think we need to draw up a letter coming from this committee to all members, asking them for their nominations and on which boards, and again sharing that information where the hospital concerned, and then make a due date to that in order for that matter to serve at the next committee meeting. Is that in order with you, Member Botha? Or is there any?
Chair, I would concur with that proposal of yours. Yes, I'm in the same, along the same vein.
Thank you very much, Member Botha. Any other member on this matter? Can we conclude that we will deal with it in that manner? Or rather, Ms. Jamke, can we now deal with the following draft committee documents, of which the first one will be on the report of the visit to the Genadendal Health Facility on the 16th of February this year.
Yes, Chairperson, but for some reason I'm struggling to share the documents on the screen. Only the presentation that is coming up. I don't know what is going on here.
You're sharing social development.
Yes, but my presentation are somewhere here. I cannot share them. I don't know what is going on with my settings.
Okay, members have received the document. Members, can we adopt?
Chair,
Yes, Member Botha.
before we adopt in the report, page 4, I'd like to amend, Chair, with your indulgence, please.
Please do, Member. Thank you.
Under 4 recommendations, Chair, 4.1, to take out the province and rather in farms across the Overberg, including the Genadendal area. The Overberg district, including the Genadendal area, and take out the province, because our visit was conducted only in Genadendal and we had the district there as well. And then on 4.3, Chair, also after farms, comma, within the Overberg district, which includes the Genadendal area. Thank you, Chair.
Thank you very much, Member Botha, for your attention to that. Any other amendments, members? You have got that, Ms. Jamke, with respect to 4.1 and 4.3. Ms. Jamke, you have noted 4.1 and 4.3.
I've noted, Chairperson, 4.1 farms across the province. Unfortunately, I did not get the 4.3.
After farms, also within the Overberg district.
Okay.
Which includes the Genadendal area.
Yes. The same as in 4.1.
Noted, Chair.
Thank you.
Chair, may I propose that we adopt with the amendments?
Thank you very much. There's a proposer, Member Botha. Seconder. Do I hear you, Member Van Vogel?
Seconded, Chair.
Thank you very much, Member Allen.
Thank you.
Duly adopted. Thank you very much. Our next draft committee document is the annual activity report for 2020-21 financial year. Are there any amendments from your side, members? Are you not able to share that one as well, Ms. Jamke? We go.
It's not on the screen, Chair.
We can see it on the screen now. I think you must just go up a bit, or at the beginning of the page. Yeah. Thank you. So you can go down, kindly check your attendance, members. Point 2, number of committee activities, public hearings, oversight visits, committee activities. Point 4. Can please go down, Ms. Jamke? Point 5, in terms of legislation. Can proceed. Point 6 and point 7. Members, are you happy that we adopt this report? Any amendments? Or
Chair, I propose that we adopt.
Thank you very much, Member Botha. Can we have a seconder?
Seconded, Chairperson.
Thank you very much, Member Allen. The report is then duly adopted. Thank you, members. Our next draft committee document will be the minutes of the 3rd of March 2021.
Chair, I've gone through the minutes. I propose that we adopt.
Are you happy? Thank you, Member Botha. Can we have a seconder? Member Kego, are you seconding?
Member
Chair,
Barnes, second.
yes, I'm seconding, Chair.
Thank you, Member Kego. This minutes of the 3rd of March, Standing Committee of Health is duly adopted. The minutes of the 17th of March. Are you happy that we adopt a proposal?
I propose, Chair.
Thank you, Member Botha. Seconder?
I second, Chair.
Thank you. I've heard Member Van Vogel, I think. Thank you very much. Thank you to you as well, Member Bakaboko-Vos. Ms. Jamke, if we can quickly go to our committee program as it currently stands. The minutes of the 17th of March is then also duly adopted for the record. Members, the 12th of May we have dealt with today. Thank you very much for your indulgence. Oversight the 19th of May to nation sites. The 26th of May.
Okay.
Ms. Jamke, why is there to be confirmed in that block? Have we not?
Chairperson, the program, we still need to identify the sites, the vaccination sites that needs to be visited by the committee. And also for the 26th, there is no agenda point at this point in time. So the members can advise. If not, that means the committee will not have a meeting on that day.
I'm sure there is enough committee business. We cannot afford not to have a meeting. Can I then also ask members to kindly, before this coming Friday, the 14th at 12 o'clock, indicate to Ms. Jamke as to which site you would like to visit on the 19th of May, whether it's a site in the metro, whether it's a site in one of the outside towns, but also keeping in mind, Ms. Jamke, we do have, on the 19th, we also have ad hoc committee, yes. So we might not want to be that far off on that day for those that need to log on for us not to have connectivity issues. So kindly relay where you would want to, which site you would want to visit as well. On the 26th of May, can I also ask Friday by 12 if you have any committee activity that we can add to the program? Is that in order with you, members?
May I ask the chairperson whether, I'm not a member of this committee.
Member Mare, just one moment, please. I recognize Member Botha.
Okay.
Thank you very much, Chair. In the light of what we spoke about earlier in regard to the hospital board and can't we then put that in as a subject matter for the 19th of May? This is my proposal. And then on the 26th of May, we do an oversight visit because there's no ad hoc that would infringe on that program on that day. And then we can go further than the metro and not just inside of the metro. Sorry for my dog barking now. Not just inside of the metro, and maybe we can do 2 oversight visits, Chair. I'm open for discussing my proposal.
Thank you very much, Member Botha. I would actually very much support your proposal in this regard. Member Mare, you would want to make an input?
Yes, I know that I'm not a member of this committee. I just take a keen interest in poverty and health matters. So I just want to know if I'm available and I do not have any other commitments for other committees, whether this committee would consider my request that I accompany them on such a visit or not.
I'm sure that we would be able to accommodate you, Member Marais.
Thank you.
Thank you very much. Member Botha, is that an old hand?
Yes, Chair, I'm lowering it now. Thanks.
Thank you very much. Members, can we then now resolve on the 19th of May? I think the appointment of members to the hospital board is quite a pressing issue for this committee to deal with, and then obviously or ultimately send to the minister for approval. Can we then amend our committee program to on the 19th of May deal with a matter pertaining to WCPP members appointed to hospital boards in the Western Cape? And then on the 26th, we then don't have to rush or be cognizant of ad hoc committee. Then we embark on vaccination site visits. And we can, or rather by Friday, then identify which sites we will visit on the 26th of May. Is that fine with you, members?
Yes, Chairperson, it's fine.
Happiness, thank you so much. Ms. Jamke, is there anything else that we need to deal with?
Sorry, Chair, in terms of the committee program, you said that on the 19th of May, the committee is going to deal with the appointment of members of parliament to the hospital board. How is this process going to unfold? Are the members going to send their names, or how are we going to do this? I'm a little bit confused now. I don't know whether members are going to submit the names on that day, which is the 19th, or...
Yes. I think between the two of us, Ms. Jamke, we'll work on a timeline after this meeting where we will again circulate the vacancies on the various hospital boards to all members. We will establish a due date by when those names should be submitted to you. And then on the day, on the 19th, we will have that complete list of WCPP members and where they would want to serve. And then the committee can deal with that accordingly. Is that fine with you?
Noted, Chair. And the other thing that I wanted to bring to the attention of the members, the 26th of May is the public hearing for the Standing Committee on Premier. So now in terms of the visits that the member wants to do, maybe outside the metro, I don't know whether that will be possible for the 26th of May because there's that public hearing, Chairperson.
Okay. Shall we then also after this meeting have a look at the committee, at the program in its entirety, and then just get back to members on that?
Yes, Chairperson.
On the most suitable date. Member Van Vogel?
Thank you, Chair. Chair, you need to guide me here, but I have an interest in the chronic deliveries of chronic medication. I went and visited a few hospitals or clinics, and all of them are saying they are not at that stage of delivering chronic medication. I'm not sure how we're going to handle it. Perhaps you can guide us, but it's a concern because what is happening, long queues with old sick people in the rain, in the sun. And you know, most of our clinics don't have that a place where people can sit under for coverage, you know. So I really need assistance here. Thanks.
Thank you very much for bringing that under the attention of the committee, Member Van Vogel. I'm not sure that how the issue would warrant us going there, because there might be a specific reason for, I think, to holistically get a picture in terms of all facilities in the Western Cape or how the chronic medication is dealt with. Perhaps we must ask the department to come and brief us, and we can then interrogate the challenges and get the necessary answers from the department, as well as you mentioned that you are aware of certain facilities that we directly ask those questions to the department. Members, I also want to mention that on various occasions, myself as well as Ms. Jamke has conveyed the invitation to members to please assist us in populating our program. I'm sure that there's more than enough health related issues that we can deal with according to our program, but that has really been a struggle. Members has not been forthcoming. So please, members, do make use of the opportunity to populate our program. This is our program, and which we all want to engage on as a multi-party committee. So please do that in future in order for us to make sure that we speak to what we need to on the program as well. Members, I will now conclude with that. Member Botha.
Chair, thank you for noting me. It's just a recommendation that I want to make for today for you from this committee. So I'm not sure whether you will allow me to speak now. It's not on the draft program at all.
I will afford you an opportunity, Member Botha.
Thank you, Chair. Today is International Nurses Day. Chair, from the Standing Committee, I would want to propose if you could put out a statement there for all our nurses that's been on the front line in terms of this pandemic that we are in and the excellent service that they have rendered to all patients in regard to treating and making comfortable patients for that came in with COVID. Thanks.
Thank you very much, Member Botha. It was indeed the idea to do so, but thank you for formally resolving that in this committee. It is much appreciated, and I do believe that we do need to extend the necessary gratitude to our nurses today. So thank you very much for that indeed. Members, thank you so much for your indulgence. Thank you so much for your active participation today, and thank you so much for everyone's valuable input into this committee meeting this morning. I wish you well. I wish you to be blessed today, and please be safe. And members, in your constituency, your neighboring constituency, kindly encourage all our elders to register to vaccinate. Encourage those young people with the phones and the data to be of assistance to those elders that needs to be vaccinated. I do believe that it is very important that we all be in this together, and indeed we can do this. So let's do this, members. Thank you very much for all of your support, and again, thank you for your valuable input. I wish you a wonderful day. This meeting is now adjourned. Thank you so much.